Welcome back, everyone, to the Deep Dive. Today, we're really getting into something loads of athletes use. Joint manipulation. The adjustment.
Yeah, absolutely. It's everywhere, from weekend warriors to the pros.
Exactly. And whether you're chasing that performance edge or maybe just trying to manage the aches and pains from hitting it hard in training, well, chances are you've either tried it or know someone who swears by it.
It's definitely prevalent. So just to make sure we're all on the same page, when we say joint manipulation, we're talking about a specific hands-on therapy technique.
Right.
Usually done by, qualified chiropractors or physical therapists. It involves applying a controlled, specific force to a joint.
To sort of fix musculoskeletal issues.
That's the goal, yeah. Addressing certain issues in the muscles and skeleton.
And look, the reason it's so incredibly popular seems pretty simple on the surface. That immediate feeling of relief, right? That feeling better right away.
That's the big hook, no question. And the research, it does back that up. It's not just in your head.
So it confirms there's a real effect.
Yes, studies consistently show pretty immediate functional benefits. We're talking noticeable pain relief, sometimes lasting up to a week.
A week is pretty substantial.
It is. And improved flexibility, too. Plus just generally better movement patterns, especially we see this in the spine.
Okay, but here's where, for us, the real deep dive starts. Because you've got these clear, immediate, short-term effects that everyone notices.
Right.
But the actual reasons why it works.
Yeah.
The underlying mechanisms. Our sources say they're, complicated.
Yeah, incredibly complex is the term used. And frankly, still not fully understood, not completely mapped out.
And that complexity, that's what we really need to unpack today. Because I think the common idea, especially if you're an athlete, is purely mechanical, isn't it?
Mm-hmm.
Like, my joint was out, they popped it back in, now I move better. Simple cause and effect.
That's the perception, definitely.
So what our research suggests is that the sound, the crack or pop, it might actually be less important than this deeper physiological thing happening.
Exactly. The sound is often just gas releasing. It's not the main event.
So if it's not just like a quick mechanical tune-up, what are the main theories explaining this change on a deeper level? What's really going on?
Well, what's fascinating is just how far-reaching the effects seem to be. It suggests something more centralized, neurological, not just a local thing at the joint.
Okay.
So one of the leading theories is that the manipulation itself acts as this significant sensory input, a big signal to the nervous system.
Like it overrides other signals.
Sort of, yeah. It essentially activates the body's own built-in pain-blocking systems, these descending pathways that calm things down. It just floods the nervous system with this non-painful, non-threatening information.
Huh. So wait, it's not necessarily fixing a structural problem right then and there. It's more like telling the nervous system, hey, chill out.
That's a big part of the thinking, yes.
But then, and this is important, I think, does that mean there's a risk? Could athletes be pushing through something serious, like a real structural issue they should be resting or rehabbing, just because the pain signal got turned down? Is it just masking pain?
That's a really critical question, and it touches on why the second theory is also key. It's probably not purely masking. It seems to be more about modulating.
Modulating. How?
Well, the research points towards manipulation actually improving the communication, the crosstalk within important areas of the brain. Specifically, regions that handle how we process pain and where we focus our attention.
Okay.
So the actual pain signal from the tissue might technically still be there, but the brain's perception of that signal, like its volume knob, you could say, it gets turned down. It effectively changes the perceived threat level associated with that sensation.
Wow, okay. That's a really profound difference then. It's not just tricking the system, it's actually changing how the brain is experiencing the body.
Yeah.
That goes way beyond just simple mechanics.
Precisely. It's a much deeper effect. And then the third theory. That takes us even further down, right to the cellular level.
Cellular, how so?
It suggests that this strong sensory input from the manipulation influences the body's electrochemical signaling pathways. We're talking about potential changes in how certain ion channels behave.
Ion channels. Those are like the gatekeepers for nerve signals,
right.
Including pain.
Exactly. They regulate how pain signals get registered and transmitted. The idea is that manipulation appears to affect this fundamental electrical communication process itself. That might be part of how it provides that sort of system-wide reset feeling.
Okay, let me try and pull those three ideas together. If I'm hearing this right, the adjustment isn't like patching a flat tire. It's not instantly repairing a structural fault.
Generally not.
It's more like hitting a hard reset switch on the body's main neurological alarm system. It gives the whole system this physiological breather, a chance for temporary optimal function. Even if the actual tissue repair, the structural stuff, that's a longer game.
I think that analogy holds up really well, actually. It is primarily seen as a neurophysiological intervention, something designed to change functional output, and often quite quickly.
Right, so let's take that understanding now and apply it directly to you, the listener, who might be focused squarely on performance. We get that it provides temporary relief, that's clear, but the big question, does getting adjusted reliably make an athlete, say, jump higher, run faster, lift heavier when it really counts in competition?
Yes. And here's where the evidence gets, well, famously mixed. It's not quite so straightforward.
Mixed how?
Well, if you look at studies testing manipulation on athletes who are already healthy, high-functioning, basically asymptomatic.
People feeling good, performing well already.
Exactly. In those cases, we don't consistently see this universal performance boost across the board. It seems you can't necessarily, improve on already great just by adjusting a joint that's likely functioning normally anyway.
Okay, that makes sense. So if I feel fantastic, going for an adjustment probably isn't going to magically shave time off my run or add kilos to my lift?
Probably not, based on that specific research focus. But, and this is a big but, where the research really does show promise is when we apply this technique to athletes who are dealing with specific issues, specific dysfunctions or limitations.
So it's about targeting the problem.
That seems to be the crucial distinction, yes. Manipulation looks like it can be a phenomenal targeted tool.
Like in what situations?
Okay, for example, SMT, that's spinal manipulative therapy, has shown some pretty clear benefits specifically for strength athletes.
Strength athletes, okay. Not endurance.
The focus here was more on strength, improving maximum strength performance and also range of motion.
Why would that help strength specifically?
Well, the thinking is if a segment in the spine, say a vertebra, is restricted in its movement, that restriction might actually impede the neural drive needed from the brain to the muscles for a maximal power output.
So the adjustment is like removing a bottleneck, a neurological one.
Exactly. It helps unlock the system, allowing the athlete to better express the strength potential they already have. It's like an unlocking mechanism.
Interesting. Okay, what about those other nagging issues?
Yeah.
Like chronic ankle instability. That's a huge one for many athletes.
Another great example where the research is quite promising. Athletes often deal with recurrent ankle sprains or just that feeling of poor stability, especially in sports with lots of cutting and changing direction.
Definitely.
Studies looking specifically at manipulating the talocrural joint, that's the main ankle joint.
Right.
They demonstrate real potential to improve functional performance for those athletes.
How does manipulating the ankle joint help with stability, though? Isn't stability mostly about muscle control around the joint?
It is, but it likely comes down to improving what we call sensory motor function and proprioception, the sense of where your joint is in space.
Okay.
The sensory input from that ankle manipulation seems to maybe recalibrate the feedback loops running from the joint sensors up to the brain and back down.
Better information in, better control out?
That's the idea. Better information leads to better stability, which translates to improved balance, coordination, and ultimately better functional performance during their sport.
And the sources also mentioned acute injuries, like on the field.
Yes, there's some support for using spinal manipulation even for acute on-field type injuries. But, and this is critical, only if the professional doing it has rigorously screened the situation first. Safety and suitability are paramount there.
Absolutely. So, pulling this section together, the real key takeaway seems to be precision. This isn't some general tune-up you do routinely like an oil change.
Right.
It's more of a targeted strike, most effective when you're trying to remove a specific, identified barrier to performance, whether that barrier is, say, chronic instability in the ankle, or restricted movement limiting a heavy lift, or maybe acute pain from a recent incident.
Exactly. Think of it as a high-impact support tool. You use it strategically to create a short-term window of improved function.
Okay.
And then, critically, you need to maximize that window through focused training or rehab.
Which brings us perfectly to the practical side, the strategy. So, if you, our listener, you get an adjustment, how do you actually integrate that immediate neurophysiological reset effect into, say, a heavy training schedule or right before competition? What are the official recommendations on that?
Well, the single biggest principle coming through is that adjustments really must be used as a support tool. They are not the total solution in themselves.
Part of a bigger plan.
Precisely. The pain relief, the improved range of motion, those are often temporary gains. To make them stick, you absolutely have to follow up that adjustment, ideally quite quickly, with the right kind of training and rehab exercises.
To kind of teach the body how to work within that new range.
Exactly. Teach it how to stabilize itself, how to strengthen itself within that new, improved functional window. You've got to train the effect into something more permanent.
That makes total sense. The body needs to learn and adapt to the new normal you've just created. But what about the timing? The immediacy. We've all seen it, right? Athletes getting adjusted minutes before they compete. Is that actually wise? Can you, like, lift heavy or play an intense game right afterwards?
Okay, so generally the sources do suggest that often there isn't an explicit restriction on immediate activity afterwards. Many people feel fine and jump right back in.
But, I sense a but coming.
But relying on that can be risky. Individual responses can vary, like, a lot.
Right. And this is where that crucial piece of caution comes in, isn't it? The thing sometimes called the 24-hour rule.
Absolutely. This is really important. Qualified licensed professionals, your chiro, your PT, they will frequently recommend waiting, sometimes up to 24 hours.
Before doing what?
Before engaging in really intense maximal effort activity, like a super heavy lifting session or full-on gameplay. You mentioned seeing athletes adjusted right before competing. That could potentially violate this guideline if the professional advised waiting.
Yeah, okay, why? Why is that 24-hour buffer potentially so essential, especially if the athlete feels great, feels immediate relief right after the adjustment?
It really comes down to adaptation and also preventing potential overexertion during that window where the nervous system has just been reset.
Okay.
Look, the manipulation just introduced changes both structurally, maybe subtly, and definitely neurologically. Giving it up to 24 hours allows the body a necessary period to adapt to those changes soundly.
So jumping straight into maximal effort might be too much too soon.
It could be. If you immediately slam that newly reset system with maximum loads or really explosive movements, you might inadvertently aggravate an underlying issue that was being masked. Or you could potentially strain tissues that are still adapting to these slightly altered movement patterns, the kinematics.
So you could basically undo the positive effects, or worse, cause a new problem before things have settled.
Potentially, yes. You risk overriding the benefits before they've had a chance to properly integrate.
Okay, that's a really key practical point. So if you're planning a major competition, or maybe a really crucial heavy training day, timing that adjustment seems critical. You might need to build in that buffer period if your practitioner recommends it.
Definitely.
And the overarching message again and again is talk to your qualified licensed professional. Make sure this treatment is actually appropriate for you, for your specific situation, your injury history, and then follow their post-treatment advice to the letter.
Absolutely. Safety has to be the bedrock of any effective performance strategy. You can't perform well if you're injured.
Couldn't agree more. Okay, let's try and summarize a core lesson here before we wrap things up.
Sure. So, joint manipulation, it definitely delivers proven short-term benefits. We see rapid pain relief, improved function, things you can feel right away.
Yeah.
It seems to really excel when it's used strategically, targeted at specific athletic limitations. Think that chronic ankle instability we talked about, or maybe that lack of mobility that's holding back a power lift.
The targeted approach.
Exactly. But, and this is the crucial link, its full lasting value seems completely dependent on using that temporary reset, that window of opportunity, as the starting point for a proper, comprehensive rehab and training strategy.
So it jumpstarts the process.
Precisely. It's like an accelerator for the program you should already have in place.
Got it. And just thinking about those mechanisms we discussed earlier, since the key seems to involve strategically activating the brain's own pain control systems, giving the body that central neurological reset, it makes you wonder about the best way to use it. Instead of just treating manipulation reactively like, I only go when I feel pain. Perhaps the most, let's say, provocative application for you, the listener, might be to think about integrating it more strategically.
How so?
Well, could using that 24-hour window, cleverly timing an adjustment to potentially create a temporary functional peak, maybe right before a key training block or a major competition, always, of course, respecting that professional advice on the adaptation period.
Could that actually maximize athletic results?
That's an interesting thought. It kind of shifts the thinking, doesn't it? From just injury response towards calculated performance enhancement, using the body's own reset mechanism to your advantage. Something to consider, maybe discuss with your practitioner,